All right, we go from the business of the morning to medical talk. Joining us in studio today, Candace Curtin. She's here from New Hanover Regional Medical Center. She's been kind enough to let me put the mic on her and figure all this stuff out while that story's going on. Now she's going to school me on wound prevention and such. Jim Gentry, who brought you out here, had a very good point. We were talking about this morning. With what we went through with Hurricane Florence and hurricanes in the past, you know, we were doing stories about people with infections. When we're dealing with a situation like that, how important is it to be very mindful of even the most slight wound that you could have on your body?
Oh, it's extremely important. Patients have a lot of different disease processes, and sometimes they don't even realize what's going on and why they're not closing and why they're not healing. So patients with diabetes are going to be particularly susceptible to wounds and to wounds that don't heal. Elevated glucose levels can cause narrowing of the vessels, which is going to impede their blood flow and have an effect on their wound healing, and also cause risk for infection. And they're going to be at higher risk for infection. Patients with coronary artery disease or who have high cholesterol and high blood pressure, which is a huge population around here of our patients, those are also going to be at risk for infection. So even the smallest wounds can cause a big issue for patients.
Yeah, and I was going to say, you know, whenever Joan will send us the topics for the week, and you see wound, I think wound is a very technical term. It's very broad because a wound can be as small as, you know, just a minor cut on one finger to a really serious case where, you know, someone would have to go to the hospital, have it taken care of. But no matter how small, there's always that risk of that wound turning into a very severe injury.
Absolutely.
Because of infection for the most part.
Absolutely. So the faster you catch it, the better it is. We typically see a lot of chronic wounds, so wounds that are 30 days or older. But if we could catch them on the front side, healing would happen so much faster, and you'd reduce your risk of complications like infection and amputation.
What do we do at home to reduce those risks? Is it as simple as just putting a Band-Aid on something, or what are the steps that go along with maybe covering a wound?
So you have to make sure you keep it clean. Hygiene is huge. Showering and making sure that you're not in standing water and bathing in a bathtub. Making sure that you're checking your skin from head to toe, especially on your feet and the bottom of the feet, and making sure that you don't see any skin changes. And if you can't do that, find someone that you trust who can. But particularly keeping the wound clean, keeping it covered, and having it checked by a medical professional as soon as possible to make sure that there are no complications with healing.
I feel like oftentimes when, you know, someone will have a cut, you may hear someone say, no, don't cover it. You know, it needs air, it needs to breathe to heal. Is that just an old wives' tale?
Absolutely.
Okay.
Absolutely. There is so much in our environment and so much bacteria and different pathogens that really would not be safe in any wound, so you should always keep it covered. We believe in moist wound healing though, so dry dressings aren't really always the best choice. Okay. You do need some moisture, but not too much, which is again why it's good to go see a medical professional who specializes in wounds so that they can tell you exactly what you need to put on.
If something is going on at home, you know, maybe your son or daughter, or maybe you nick yourself in the kitchen with a knife, just something like that, and you do bandage it up, how many days out to where, you know what, I think I've got, how far out do we go before I probably should see someone about this?
So I would say 2 weeks. You
Okay.
know, typically that still keeps you in the acute phase of healing, but you know, at 2 weeks, if you haven't seen any change or any improvement, then something's happening,
Yeah.
something's going on. The body heals very quickly, and it starts the healing phases almost immediately. So you really should start seeing a change in just a few days, and if you don't see a positive change in a few days to 2 weeks, then absolutely get in with your physician or call us at the wound clinic.
Yeah, so it was great. I swear every time I always hear someone, no, don't cover it. Don't cover it. Let the air get on it.
No, don't do that.
And all right, and very quickly, when you say to have like a moist dressing or a wet dressing, could that be as simple as like the antibiotic that you'll put over it, you know, Neosporin, for lack of, you know, I don't know the generic terms of these?
Well, it could be, but there are over 5,000 wound care dressings out there now that are considered advanced wound care. So there are a lot of better options that your doctor has access to that you don't.
Gotcha.
They're not over the counter in most cases, so it's things that the physician could order for you.
All right, it's great information. And again, don't call us at the newsroom, you know, because I'm just going to recue this and say, well, Candace just said this. You can call and get a professional's opinion on stuff like this. Call the hospital and get in touch with the wound care specialist. Candace, thank you very much.
Yes, thank you.